Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. In this regard, I would like to thank for your coming to here today in my presentation. Also, I would like to thank you very much for the Committee of SiRes 2022 for giving me as a chance to present our result. In this regard, I would like to present the title, The Achievement, Clinical Competence and Professional Behavior under Medical Graduates Perspective. As a background, that we know we have some statement or some argue that the professional behavior and clinical competency of a doctor reflect a range of personal and interpersonal qualities, attributes, behavior, commitment, and values. Also, in the other statement, that clinical competence and professional development are two important things as reflection of achievement of medical education outcome. Our study have the conceptual framework. In this regard, the conceptual framework was structured as follows. Medical graduates' perception as a form of self-evaluation because medical graduates has undergone to the educational program and then they have worked in the employment. Professional behavior and medical competency of them can be a benchmark for the success of an institutional outcome. However, research that explores the perspective of graduates is an area of concern. So, for the study, we have the aim to identify the achievement of clinical competence and professional development from the medical graduates' perspective. In some literature review, we found that the professional behaviors reflects to a set of quality and attributes of a person behavior that is observable and relates to medical practice. According to other authors, we learned in 2006 that medical competence was defined as a number of abilities and skills that must be mastered by a physician to practice medicine. While according to Hodges in 2019, he mentioned that medical professionalism calls upon its group members to jointly profess what the public and individual patient expected based on set competence, criterions, and ethical values. Our study has some method. The design of our study is the observational analysis. And for the sampling, we have recruited 206 medical graduates in survey of questionnaire with purposive random sampling strategy. For this research, we use the graduate evaluation questionnaire that consists of 35 items with 6 domains, and the domains that were related to the medical competence and professional behavior. Data analysis, we use SPSS version 24, which we presented the mean score of each domain, and we compared of it and which domain are most favorite present to it. In this slide, we have highlighted that the demographic data of 206 participants can be seen that length of time since graduates was dominated by alumni that has been graduated 2 till 5 years, the amount of 45.15%, and the workplace of alumni successively from the most to the least is others, start from others, amount of 69%, then public hospital, private hospital, degree hospital, primary healthcare, and lecturer, 50%. In this table, you can see that the participant, female participant, is more than male participant, and the age of participant is about 25 until 34 years old. For the perception of 6 domains that we conducted or studied, our mind finding saw that the alumni have a very good perception of the humanism character of Muslim doctor, 95.67%, and interpersonal skill, the amount of 91.26%, and also perception regarding patient management ability and professional behavior are taken were assessed well, because each of them have a value of more than 85% or maybe 86%. And the main score of the lowest and highest achievement of our study, that the highest score got the humanism character of Muslim doctor, the amount of 95.67%, and we interpret the very good perception, and the lowest score got clinical skill competence factor, then interpret the good perception. For the discussion, based on our result, that aspect of clinical skill competence was rated the smallest by medical graduates. This is due to the ability of clinical skill continues to develop in line with the advancement of medical science and technology. Moreover, aspects of interpersonal skill are gained very good undergraduate. This is due to the skill is a factor that contributes to successful dealing in maintaining appropriate relationship with patient and other colleagues. And the last, based on our research, we have concluded that according to medical graduates' perspective, humanism character of Muslim doctor has met the institution expectation, and this is highly relevant with the vision and mission of medical faculty of Unisba. And interpersonal skill aspect got an excellent perception also. However, beside that our result is very good and excellent, we have highlighted and we have concerned that there is a need to strengthen aspect of clinical skills and improve the cognitive abilities of medical students while participating in educational program. This is for our reference. Maybe some of you can be repeated our research. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.